Let me show you how you can save a life with a little piece of plastic. So when I say plastic, I literally mean plastic. Look at these. So these are oropharyngeal airways, also known as oral airways, Guedel airways. And I've got 3 different sizes here, so I've got a small, a medium and a large for adults. We would only use these in an unconscious patient. Just remember that, never use them in semi-conscious patients or conscious patients who have a gag reflex. As soon as you start putting them in, we'll get a gag reflex. We can then send stomach acid, stomach food, and pump up through the esophagus into the trachea and then aspirating through particles or stomach contents into the lungs, and that's not what we want. We should only be using these on an unconscious patient. And I must state that these videos that I do are for educational purposes only. It is never for a substitute for training. You should always be trained and be deemed competent in everything that you're doing within the healthcare field. So, with the airways, the main function is to make sure that the tongue doesn't occlude the airways. And the way we do that, so when we're sizing them up, we need to make sure, so little Malcolm over here, I want to make sure that when this sits inside, so it's eventually going to sit here, okay? So it's going to go down the trachea so that we can help the patent airway. Can you see how there's a little hole in the bottom? So that's where the airway is going to be. It's going to sit like this when it's inside. I'm going to show you everything outside so that you can see exactly what it should look like. So it should be like this. The way we measure them is from the corner of the mouthpiece, say from the incisor to the angle of the jaw. Angle of the jaw, I mean the corner, bony prominence that you can feel here. So say from the side of the mouth to the jaw. So we measure them up. So you would have it, and basically you want his teeth and his lips to be here where my fingers are. Once it's inserted into his mouth that way, his teeth and his lips should fit perfectly around that. And this bit of it, this round bit, can you see there? This bit here, the circular bit, that should lay outside the body. That does not go into the mouth. We do not push it that far in, okay? So when we're measuring up, that one will probably be slightly too small for him, whereas this one for our Malcolm will be better. And then this one, if I show you, you can see it's clearly too big. So can you see where his mouth is? That's going to lie about there. So it's going to lie that far away from his mouth. It's no good. Whereas the small one, his mouth will come right up to the edge. So we're going to go with the medium one. Now, when we insert them opposite to what you think, actually. So we're going to insert them this way. And the reason being, if we insert it this way and go straight down, you're going to push the tongue down even further, cause more of an occlusion. Sorry, Malcolm, I've just pulled your face off. But this, I've just done it just to show you a close-up of how it is. So when it sits in his mouth there, underneath, if you can see, this is how it would then go down. So the air goes straight then into his windpipe, and you can get the air to his lungs without his tongue being in the way. So that is how you save a life with a little piece of plastic.